If you know this basic biochemistry, most of the understanding of the macrocytic anemia is solved. So already you know about what is microcytic and what is macrocytic anemia. So whenever any vegans come to you, he suffers from, what are the clinical presentation? In modern day curriculum by NMC, it's your first duty to be introduced to clinics. Everything you read, it's related to how you deal with the patient. Tumra ja porbe, it will facilitate in identifying new diseases, new signs, new symptoms, nothing else. Every reading, every understanding will be directed to that. So, anemia, what are the symptoms? Apart from weakness, lethargy, etc., what are the symptoms? Especially in B12, as it helps in proliferation, maintenance of nervous system also, there is tingling, numbness, neuropathy type symptoms. So, you have to be very careful about that. Apart from normal common symptoms, lethargy, weakness, etc., you may have different skin symptoms, you may have glossitis. Apart from that, you will have neuropathic symptoms related with nerve, tingling, numbness. So, these are basic actions of the vitamin B complex group of vitamins. So, the anemia we are dealing with is in nutritional anemia. You always remember the headlines you are reading. Otherwise, you won't be able to fix your objectives. Say, what should I read? This is very important. So, this is nutritional anemia. Then it will come as hemolytic anemia, where the RBC doesn't stay for longer in the body. Then it comes different forms of anemia. So, this is nutritional anemia. These are our agenda of today, outlines, definition, etiology, pathophysiology. What is the meaning of etiology? Cause, very good. Pathophysiology. Pathophysiology and pathogenesis almost are equal. How the disease progresses and how the disease develops. This is pathophysiology. Clinical presentation, you know, lab diagnosis, you know, management, it's a easier part. So, this is a nice definition. You can write 1 or 2 lines, and this is already explained in your discussion. The megaloblastic anemia is a red blood cell disorder due to an impairment of DNA synthesis that leads to ineffective hematopoiesis, distinctive morphologic changes, and abnormally large erythroid precursors and red cell. Why it is large? Anyone? Red cells and red cell precursors in the bone marrow, they are large. Why? Because there is lack of every question in medical science, you must ask why. Otherwise, you cannot remember. There is no what? No vitamins, no DNA. The nucleus remains immature. So, in a cell, it's a precarious, very abnormal conditions. Nucleus is immature. It cannot go further. It cannot divide. Cytoplasm is mature because cytoplasm has got RNA. It is mature. It is ready to divide. Nucleus cannot. The cell ultimately becomes very, very large. This is the basic of macrocytic anemia, that is nutritional anemia. Next, it can be singular simple B12, it can be folic acid deficiency, it can be combined, it can be something else which is patients are unresponsive to between B12 and folic acid. These are the long list taken from probably from a good textbook. You know this. Why there is B12 deficiency? Tell me where from B12 is absorbed? From physiologic knowledge. Where from B12 is absorbed? Terminal ileum or slightly proximal, duodenum, like this, where it is written. So, remember that both of these are absorbed in jejunum, ileum, like this, the proximal part of the small intestine. So, any disease, any deficiency, any disease which involves the proximal part of the ileum, jejunum, etc., they will disrupt the normal absorption. So, this is the basic. And do you know the definition of pernicious anemia? Pernicious anemia. Very important for any exam, where there is deficiency in intrinsic factor. It may be deficiency, or it may be that there is antibodies developed against intrinsic factor. So, but we are not so concerned because the pernicious anemia is not common in our country. It is common in Europeans, not common. So, this is a long list. So, pathophysiology in one line, remember, basically what B12 does, B12 helps in a very basic biochemical reaction where homocysteine is converted to methionine. This is one basic reaction. In this reaction, they release folate. Folate helps in synthesis of folic acid. The folate is available to the DNA synthesis. So, basic reaction is homocysteine to methionine. Next, clinical presentation, I have already told you the anemia symptoms, the basic, the common symptoms, the neurological symptoms, the gastrointestinal symptoms. Neurological gastrointestinal symptoms are glossitis, geographical tongue, or some says beefy tongue, and there may be neural defect, neural tube defect, etc., etc. So, this is normal RBC. This is RBC in the megaloblastic anemia. So, here the neutrophil has got 3 lobes, 3 segmentation. Here the neutrophils have got multiple segmentation, more than 5. If it is 6, it is almost diagnostic of, you have to exclude possibility of megaloblastic anemia. So, by taking simple blood for CBC, that means complete blood count, we can diagnose megaloblastic anemia by seeing the blood, but also by biochemical parameters like vitamin B12 folate assay from blood, serum, or some by special test. Apart from that, we can do bone marrow. Bone marrow examination in iron deficiency is not a must. Not a must. You can do iron profile from peripheral blood. The serum iron, ferritin, total iron binding capacity, etc., etc. But in bone marrow, in megaloblastic anemia, it's an indication for doing bone marrow. তাহলে যদি তোদের বলা হয় যে if you are asked in the examination, যে tell me two causes of anemia where there is indication for bone marrow examination, তখন কি বলবি? One is megaloblastic, another is aplastic anemia. Aplastic means the bone marrow is not proliferated, hypoproliferated, depressed. It may be due to primary, de novo, it may be due to secondary causes. So, aplastic anemia and macrocytic anemia are indication for doing bone marrow. Remember this throughout your life. Aplastic anemia and megaloblastic anemia. So, what is this? This picture, this is the fathers and forefathers of RBC. That means normoblast. Where do they stay? They stay in the bone marrow. Our RBC's fathers and forefathers. Normoblast. Look at this, small size. In megaloblastic anemia, it looks like this. It looks like this. Very big, sieve-like appearance. Sieve-like appearance. Jal, Bangla bolle jal. What is that? Like a sieve-like appearance. See the chromatin character. See the chromatin character. This is very big. This is sieve-like appearance. The cytoplasm is deep blue. There is a halo here. The pale area here. And this is completely different. So, by doing bone marrow examination by expert, you can diagnose, probably you can suspect that probably the patient is suffering from macrocytic anemia. So, bone marrow is very, very hypercellular. What is the defect in bone marrow? Because of the unavailability of folic acid or B12 or both, they cannot replicate, they cannot give rise to small RBCs. So, this is common not in case of erythropoiesis only, it is common in leukopoiesis, thrombocytopoiesis, everywhere. So, all the cells will not divide. So, bone marrow will be very, very hypercellular. In peripheral blood, there will be pancytopenia. So, where from our cells come? From the bone marrow? Bone marrow is hypercellular, full of cells. Our fathers and grandfathers, but in peripheral blood, RBC are deficient, WBC are less in number, platelet are less in number. So, this peculiar condition is found only in this macrocytic anemia or megaloblastic anemia. Remember that everything is very large. MCV is mean corpuscular volume, which is the measurement of the size, not size, total dimension of the RBC. It is more than 100 femtoliter. আমরা কি করে এটা calculate করব? We can calculate it or we can have it from modern machine. তাহলে আমরা যদি দেখি, if it is যে RBC, one of the important dimension, that is mean corpuscular volume, is more than 100 femtoliter, will suspect megaloblastic anemia. Why reticulocyte count is reduced? Reticulocyte mane janis? Nothing but slightly premature RBC. We have given a special name, hi-fi name, nothing but a slightly mature RBC. So it should be less, because reticulocyte only increases where there is bone marrow is very, very active. It is replicating, it is dividing. So it will be less naturally. So every cause, every symptoms has got a why in the background. You have to ask yourself why. Macrovalocyte, don't say macrocyte, you say macrovalocyte. Anisopoikilocytosis means different in size and shape, etc., etc. So this macrovalocyte means very big RBC and hypersegmented neutrophil, macrovalocyte. This will, when we see under microscope, if we see these two findings, we will say, okay, the patient might be suffering from megaloblastic anemia. মেগালো মানে বিগ, আমাদের থাকে না, তোদের অনেক বন্ধু বান্ধব আছে মেগালো, আমরা বলি তো, মানে কি thinks very high of themselves. The same thing, megaloblastic erythropoiesis, very big erythroid precursor cell, and also the metamyelocyte, giant band form. That means all the precursor cells in the bone marrow will be very big, nucleus will be very big, they cannot divide. So these are the, for you to write in the exam paper or answer script, this is important. What are the total set of investigation? Because you have to fill up one page. Suppose this will have a 2 plus 2 plus 5 plus 5, like this. That this will have a 5 or 7 marks. What are different investigation of a megaloblastic anemia? So you have to write everything. We have to measure serum, B12, folic acid. Eta kotheke measure korbo? From blood serum, clotted blood. We will separate the serum, we will measure it. We will measure it methyl malonic acid. We will measure piglu. We will measure sealing test. Sealing test is, tora porchis in physiology, it is nothing but a test of B12 to identify whether the B12 is from nutritional deficiency or whether the B12 is from faulty absorption. That is sealing test. So this is all about. Eta mone rakhbi je shudhu B12 measure korle hoy na. You have to measure MMA, methyl malonic acid also. Shudhu B12 measure korle we will miss the very, very subclinical cases, early cases we will miss. Karon ki B12 helps in the basic reaction of homocysteine to methionine. Tale replacement therapy, folic acid, B12, we have to replace, tora janis to. At pharmacology I have read, folic acid koto 5 milligram tablet pawa jay. It's available in 5 milligram tablet. Our daily requirement is probably 1 to 2 milligram. And B12 it's called methylcobalamin or cyanocobalamin. It is available in tablets, in injection forms also. In severe cases, give injection. In non-severe cases, give tablets. By summary, megaloblastic anemia is caused by deficiency of folate or vitamin B12 that lead to inadequate synthesis of thymidine and defective DNA replication. Results in enlarged abnormal hemopoietic precursor, যেটাকে আমরা বলি megaloblast, ineffective hematopoiesis, macrocytic anemia and pancytopenia. তাহলে B12 deficiency also associated with neurologic damage, particularly in the posterior and lateral tracts of spinal cord. দেখবি তোরা একটা condition পরে পড়বি in neurology, you'll read what is that condition called? Subacute Combined Degeneration of Spinal Cord. সেখানে তোরা এটা পড়বি, nothing. Nerves covering is myelin sheath. So what is the basic thing? B12 helps in maintenance of the myelin sheath. If myelin sheath is not there, the sensation and the motor parts through the nerve will not spread. This is the basic. Don't be ashamed to ask question. Yes, sir, আমি এটা বুঝতে পারিনি সেই ক্লাসে. Don't be ashamed, ask question, because we are all students. I am also student. I have also read books. You have to read books for passing. I read books for enrichment of my knowledge. You read books for passing examination. This is the only difference.